Good afternoon to all. Welcome to all guests that have signed in and are joining us at this online webinar, Living with COVID-19. Are you ready to get back to work? Organized by CANSEE, Canadian-Serbian Business Association, in cooperation with a valuable CANSEE member, Kinstellar Law Office, and CANSEE longtime partner, ICT Hub. Our special guest today is Her Excellency Kati Csaba, Ambassador to Serbia, North Macedonia, and Montenegro, residing here in Belgrade. And she will be with us here today, giving us an insight on Canadian actions during this pandemic. Madam Ambassador, welcome.
Thank you. It's a great pleasure to be with you today.
If I could just see you, maybe?
Yes, there we go.
Great. Welcome. Welcome. Thank you for joining us today. We are very glad to see you and believe since you have been here in Serbia all this time during special measures while carefully following the situation in Canada, that our guest listeners will be very interested to hear what you have to say on what are the measures that federal government of Canada took to prevent the spread of COVID-19 virus, and how do they differ, and do they differ very much from the approach that we have taken in Serbia? We really know and believe that each government, in this case Canadian and Serbian, were and still are very dedicated and conscientious to do all in their power to save lives in their citizens.
Well, first let me say hello and welcome to all of the participants for this webinar, and thank you to CANSEE for organizing it, and thank you to the partners for participating. Again, it's a pleasure for me to be here with you today and to talk a little bit about what we have done in Canada and compare that with the measures that have been taken in Serbia. Yes, indeed, I have been in Belgrade throughout the period of the crisis, so it gives me some perspective on how things evolved here. Also looking, of course, at the measures that were taken in Canada. To start, just a little bit of context as a reminder to some of you who maybe are not so familiar with Canada, but we have a federal system that divides responsibility between the federal government and the provincial governments and territorial governments. So in our case, because health is a shared responsibility, it means that not only was the federal government, for which I work, very much involved in coordinating the response and taking important decisions, but each province and territory was also very involved, and they were taking their own decisions based on the context in their area. Also, just to start, we were, well, I can't say we were fortunate, but Canada was affected by the SARS crisis in 2003. And so that actually helped us to develop all kinds of pandemic planning. Not to say that any country could have been fully prepared for a crisis like this one. It's just been so enormous and has spread so quickly, but it did help us to understand a little bit better how we needed to organize things. And so we were to some degree ready in advance, but of course then things just took off like wildfire. And so in terms of measures, let me start by saying that first of all, our government tried very hard to take decisions that were based on scientific evidence and based on recommendations, for example, coming from the WHO. And so over time, we've seen that some of those measures and recommendations have evolved as the science has evolved to provide us with more information about coronavirus. So the very first measures, of course, we're very much focused on the basics. So personal hygiene, hand washing, coughing or sneezing into your elbow, making sure that you were keeping a safe physical distance from other people, very strong encouragement for people to stay home and not go out unless they had to go out for essential reasons, all with the basic premise of trying to keep people safe. Then the government worked very hard on ensuring that we had an adequate supply of personal protective equipment, PPE, for those who were in need. And as we discovered in the early days, the provinces and the federal government were all sort of trying to compete on the world market and trying to purchase these very valuable supplies that were in great demand. So at a certain point, the federal government took over that a coordination role on behalf of all of the provinces as well to make it more efficient as they were doing their purchases. Then businesses and organizations that provided services to the public, so everything from bars and restaurants and cafes to public libraries and public swimming pools, hairdressers, and all of those places were asked to close to prevent, again,
I guess schools, spread. Right?
To close, yes.
Yes.
And so in terms of retail services, it was really only the essential ones that remained open. So supermarkets, pharmacies, basically, that were providing those essential services. We moved very quickly to a lot of online shopping, I can say, although that wasn't organized by the federal government, but a lot of people turned to online shopping in those conditions. And as a government, we were also very much focused on essential services. And so each ministry in the federal government took decisions about which are the staff that can work from home and which are those frontline essential workers that need to be still in the office and need to be able to provide services. So in terms of our own Ministry of Foreign Affairs, we were very much focused on helping Canadians in need, including
We don't hear you now. Maybe it's just the internet. We'll wait for a minute.
These are online information that are available to all travelers. And by the middle of March, we were saying to people, do not travel outside of Canada except for essential travel. Soon after that, we closed the borders for all except for essential travel, including we closed our border with the United States. And just to remind people that the US-Canada border is the longest undefended border anywhere in the world, and it is a very rare thing to close that border. But on both sides, it was felt that this was important. And then, as I mentioned, because different provinces and territories were facing different situations, some provinces also chose to close their borders between provinces because they didn't want an inflow of people from one province that maybe had many cases to another province that had far fewer cases.
And that's probably first time also that something like that happened.
So I think so. So the highest number of cases were in Quebec and Ontario, and so provinces on either side were trying to be very cautious to not allow for cases to be exported. We also instituted a mandatory period of 14 days of self-isolation for anyone who was returning to Canada from outside the borders. And people were also encouraged to respect that 14 days if they felt that they might have symptoms, but it was still too early to get testing. And then an important thing as well is that the government at the federal level has approved over the past 2 months billions of dollars in funding for a whole range of activities. To support small and medium businesses and enterprises, to support larger businesses in different economic sectors. We've put a lot of money now into research and development activities, including in funding towards finding a vaccine. And we have not forgotten that what happens in other countries can have an impact on the health of Canadians. So we've continued to provide significant amount of humanitarian assistance and development assistance that are specifically focused on coronavirus in other countries. So if I to turn to the second half of your question about what are the differences with Serbia, I mean, as you said at the beginning, I think every government is doing its best to keep its people safe through whatever measures they see as being most appropriate for their country. One difference I would point to is that in Canada, there has not been an official curfew or policajski čas. So but the government has been strongly recommending that people not go out except for essential reasons. So the effect is more or less the same, but they were, I think there have been a few cases of people actually being, first they were getting warnings from the police, you know, why are you out here? You shouldn't be out having a picnic. And then over time, the police had started to issue fines for people who were disregarding those recommendations. And another difference I would point to was that in Canada, Parliament remained engaged in the process. So even though they weren't meeting physically, they were continuing to stay involved in the legislative process. So all of the funding that I mentioned was approved. It did go through Parliament, and it did get approved by the government through the voting process. I know they faced some challenges because they used a combination of having members of Parliament come in person and having them vote and participate online. And just to share a little anecdote, because we're also an officially bilingual country, our Parliament always works in 2 languages. So MPs can speak in whichever language they choose, and we have this system of simultaneous interpretation. So as I've understood from some colleagues and from reading newspaper reports, this turned out to be one of the biggest challenges, is how to make the translation system work when people are joining online. But anyway, they found a way to make that work.
Excellent.
So that's what I would say for that question.
Thank you very much. And I'm glad to hear that we pretty much did the same thing, and at the end that, people and lives have been saved, but now we're moving to, I would say, to a second step when the danger of the virus subsiding slowly. And what interests me as well, we will hear later from Dragana Bajić from Kinstellar what are the measures, because the state of emergency was, finished last week. I'm interested to hear, obviously you didn't have it, but what are the measures now that the government of Canada is recommending? Are the businesses slowly opening? And what are, in particular, the measures about health and safety of the employees, when we are reopening the businesses? That's the key for all of us. Obviously, we were for 2 months, acting very responsible. Businesses were closed, but as we all know, economics is a key. We need to continue. But again, I would say we have to be very, very careful, how we will proceed. Also, for example, are all of your employee staff back to the office now? For example, in my case, in our office, I'm now in my office, so that's why I don't have a mask, but I wear it all day long with my colleagues. And also I institute where one came 2 weeks ago back, and the other one just came back to work. And like I said, we have special measures of cleaning the door handles. So I'm eager to hear, shortly, what are some steps? Is Serbia a little bit ahead? How's Canada approaching this second step, I would say?
Okay. So I mean, Serbia has the numbers in Serbia are certainly on a very positive trend in that they're going down. So that has allowed for these measures to be loosened. In Canada, the situation is also improving, but we still face a number of challenges, and we're talking about a much larger volume of cases as well. So I was checking the statistics. And as of yesterday, we had almost 70,000 cases of coronavirus, so 70. and we have had almost 5,000 deaths. So if you compare that to Serbia, obviously it's very significant. We are on a downward trend, so that's the good news. One of the concerns that we've seen is that a number of the deaths have occurred in long-term care facilities, so like old age homes, which is where you have, of course, groupings of very vulnerable people with existing health conditions who are elderly. So we're still working on how can we best tackle those specific situations. One of the things that the government and the provincial governments are doing is increasing significantly the number of tests that are being administered, so that we can get a better handle on how the situation is evolving. I would say that those basic hygiene and physical distancing measures are still key to the response, and everyone is still being encouraged to follow those as much as possible. But in the meantime, each province is developing its own plan on how they are going to bring people back to work, how they're going to get businesses back to working full on. And I think we all recognize that there are really difficult choices facing every government and every company, frankly, because on the one hand, you need to be thinking very much about the health of your people, but you also need to be thinking about the health of the economic aspects, the health of your economy as a country, or the health of the economic future and survival of your business. So in our case, I think the emphasis is overall on taking very gradual and slow approaches, and giving enough time in each phase of the return so that you can check, are the numbers starting to go up again? Are we seeing an increase in cases because we've loosened measures? And then that guides, I think, each government to decide, okay, do we go ahead then with the next phase, or do we wait a little bit longer? What I've been told about the federal government is that it is probably going to be months before all staff of every ministry are working back in the office again. Mm-hmm. And I also checked this morning, the borders of Canada's borders with other countries remain closed except for essential travel and essential trade, of course. But there's no news on when borders might be reopening, and I know that Serbia is already looking to that, and we'll hear more about that, I think, in a few minutes. But in terms of our embassy, the embassy has been open throughout the entire crisis, but we have focused only on essential services. And so, for example, Canadians who needed consular help could only enter the embassy through an appointment, and we were trying to keep those to a minimum. And right now we've been working on a system of 2 teams. So we have one team that works 1 week, and then they work in the office, and then they work from home the next week while the other team is in the office. And this way we've tried to reduce the possibilities for getting each other sick and spreading the virus. And our plan at this point is to keep that rotating system in place for another few weeks and look at a gradual return. So again, we are open, we are providing services, but we do not yet have all staff in the office, and it will probably be another few weeks before we have people back. In a situation like this, our ministry is leaving it to the embassies to determine really what are the moments when it is safe to bring all the staff back, because we know better what are the local circumstances, yes. How is the situation evolving here. And then just a final word, I think as a government, we are also starting to think about the longer term and what is going to be the new normal for everyone, for the government, as a country, for our business sector. And I'm sure that the same thing is happening in Serbia. We hope that there will be a vaccine relatively soon, and that will change things. But maybe this new normal will stay with us forever. I don't know. I think we've discovered that that people can do telework in many cases, not in every case, but we can do online discussions like this one today, and we don't necessarily have to be all in the same room. And so I think we're all going to be thinking about how does this affect the work that we do going forward. I think we're also going to see measures in place that would have been unthinkable a few months ago. You were mentioning about, you know, wearing masks in the office. When we bring our staff fully back to the office, we also are going to be looking at all of those things, making sure that the hygiene measures, you know, the washing of the door handles and keyboards and all those things will need to stay. We will need to keep physical distancing amongst ourselves. We will need to wear masks when we are coming together as a group. And I think those also will be in place for a while. And for me, as part of the Canadian work culture, there's been always this feeling that, oh, well, if you're a little bit sick, you know, it doesn't matter, you still go to the office. And I think that has changed as well, that we're all now thinking, if I'm feeling symptoms of something, I really should stay home and not infect my colleagues. And I think that is a change that is going to take root, and I hope will be around for a long time.
Thank you very much. We're running a little bit of time, but this has been so interesting, you know, for us to hear, and many good points. You know, we really appreciate it, and it does feel that, you know, we're also learning from each other. We're learning amongst ourselves, and you know, each country is individual. Like you said, we will have to see until we're absolutely sure that we're safe, you know, and then we will start, you know, running full business, relaxed like we were before. But the changes will stay. I will thank you now, and just because we're a little bit running out of time, and I would like to introduce.
Sorry about that.
That's okay. No, we've enjoyed it. And I'm sure our guests had a totally new insight to hear how, without state of emergency, you know, it was possible to fight this real pandemic. Thank you again. I will now introduce our second panelist, Ms. Dragana Bajić, Managing Associate from KINSTELLAR Law Office. That is our valuable CANSEE member. She has a substantial experience in labor law and employee matters, ranging from individual to a complex restructuring, workplace, and mass layoffs. Dragana will be discussing, we all know and are informed by the ministry that now that, you know, we're done with the state of emergency, businesses are slowly reopening, and there are now recommendations by the government of Serbia, draft recommendations how to act now to use the preventive measures to safe and healthy workplace. And we're all looking forward to this decision to be adopted because at the end of the day, the health and safety of our employees matter the most. And like Madam Ambassador said, we need to get the economics going. You know, that's very important for us. One little thing, I would like to encourage all our guests and attendees of this webinar to feel free to use an option to post their question on the chat, or even to wave their hand, and if the question is a little bit long, so we will be able to answer it. Please use this chance. Don't hesitate. And I will give a floor now to Ms. Dragana Bajić. Welcome. And I'll give you a floor to let us know what are the measures, what are some things that are already in action, what we're waiting for, what's maybe some of the announcements. So welcome and thank you.
Thank you too, Mirjana. I just want to check, do you hear me?
Yes.
Yes. Great. Great. So hello to everyone. Thank you, Mirjana, for giving me this chance to speak at this event. And also I would like to thank Madam Ambassador for giving us this great insight and into how things are going in Canada. I believe, the situation is pretty similar, other than the curfew and the parliament not being in session. But most of the things are pretty general. As Mirjana mentioned, I'm a lawyer at Kinsteller, which is an international law firm. And in addition to Serbia, we also cover 9 other countries, Romania, Bulgaria, Hungary, Czech Republic, Slovakia, Ukraine, Turkey, Kazakhstan, and Uzbekistan. And we're also covering the region of former Yugoslavia from our Belgrade office. So we have been following closely the development of the measures related to the COVID-19 pandemic. And I can say that most of these countries do not have any specific back to work rules. So most of the rules are pretty general. They relate to everyone, with the exception of certain specific businesses, such as was done earlier in our case, also, the cosmetic salons, hairdressers, construction sites, certain parts of hospitality industry, but there are no general rules that would apply to all employers. So there are the general measures are based on the general guidelines of the World Health Organization, and they're also the similar as the guidelines and the rules that exist here. So as you mentioned, we expect that, and there were also certain announcements made in that direction, but it's still not clear what will actually happen. We expect that we will have soon a set of rules, so actual rules, not just guidelines and recommendations, that will apply to all employers in the back to work scenario. You know that we don't, so it's been a week since the state of national emergency has been lifted here in Serbia. And we still have only a very limited set of rules that apply. So employers are pretty confused as to what all measures, preventive measures that they need to undertake in order to create a safe working environment for the employees, because creating a safe working environment for the employees is one of the main obligations that every employer has under the law on work safety. There are currently only a very limited set of rules under the law on protection of general population against contagious diseases. So we have the general ban on the public gathering in both open and closed spaces. So you cannot have more than 50 people gathering in both, as I said, open and closed spaces. And there are certain rules if you have gatherings of people that are allowed. You need to all people need to wear masks. And also, if it's a closed space, probably gloves. It's not completely clear what it means. It is stated that that a person needs to undertake preventive measures related to disinfection of hands. So does it mean that before we go out to the park or you know to a walk, we need to wash our hands, or do we need to wear gloves? And it's not completely clear, but I would say that in a closed space, you need to wear you also need to wear gloves in addition to masks. And also there is this general rule on keeping the distance of at least 2 meters between 2 people who come together, both in an open space and in closed spaces. We also have certain rules that relate to retail shops, small retail shops, then movement of and public gatherings in shopping malls. It is clear that you need to in small retail shops and those hospitality services where they serve food and drinks in the open. The employees serving you need to wear masks. There need to be there is this need to keep the distance of 2 meters or to pose that plastic barrier if the distance is not possible, but only the employees need to wear the mask, so not the customers. However, if we have shops in a shopping mall, then also the customers need to wear masks. There are also certain rules in those cases that there is a mandatory disinfection of furniture, of equipment after servicing each customer. But these are the only rules that affect these specific types of businesses. So retail and shopping malls and hospitalities, the part of the industry, hospitality industry that serves food and drinks. For everything else, we actually do not have any rules. So yes, because after the state of national emergency was lifted, all the rules that were passed during the state of national emergency are no longer apply. It is now, as I said, a lot of employers are confused as to that are not part of these businesses for which we have specific rules about what measures they need to undertake in order to create a safe working environment. Before I go to what might be expected, I would also like to mention another rule that we have and that might be important also to your members. It's a new rule. It regards entering of expats into Serbia. That was adopted by the government. This decree was adopted yesterday. Basically, all of those expats that have a temporary residence permit or a permanent residence permit in Serbia, they can avoid that 14-day self-isolation. That was a rule before yesterday. If they provide a negative PCR test on the coronavirus that is not older than 72 days. Please just have in mind that this test needs to be issued by a acknowledged laboratory that is on the list of the Ministry of Health and Ministry of External Affairs. I haven't checked whether there is such a list already published, but it needs to be one of those recognized laboratories that are authorized to take such tests. So it needs to be a test from the country that you're coming from, or from the country that you're entering from into Serbia. If you can get that, there's no need for you to stay in home isolation for those 14 days.
I think that's fair. It gives an option because these are temporary permanent residents of Serbia. So why not get that treatment? So thank you.
Yes, but for those who are who do not, so those expats who need to come to Serbia for various probably business reasons, but who do not have a temporary residence permit, they can come to Serbia only if they get a permit of a special committee that will be comprised of members of various ministries. And also provided that they have this negative PCR test that is not older than 72 hours. You get the procedure for obtaining this permit of this committee to enter Serbia starts by sending an email to special designated address of the Serbian Chamber of Commerce. There is on the website of the Serbian Chamber of Commerce there is a list of details, information that you need to provide, including the reason of the expat of why the expat is coming to Serbia, and also you need to provide a scan of this negative PCR test, and it is expected that this committee will issue this permit allowing entrance to the expat within 24 to 48 hours. So this is fairly new. So these basically these are the rules, the only rules that we currently have. There is a recommendation of the crisis committee also that might be important for you to hear, that the government lifts the ban on traveling to and from 4 neighboring countries as of 1st of June this year. So that will regard Bosnia, Albania, Montenegro, and North Macedonia. So since this is published as a recommendation of the crisis committee on the website of the government of Serbia, I presume that this will be something that the government will adopt, that we will see soon. So for these 4 countries, we can expect that the traveling will be easier.
Thank you.
In this past week, I had a chance to see a draft of a decree that the government is considering to adopt, that would include a set of rules that would apply to all employers in Serbia. This decree, as I understand, was distributed among some experts and some business associations, and it appears that a lot of people were unhappy with the provisions of the decree. And I can say, in my personal opinion, there are a lot of clauses there that are really impossible for all employers to implement in a proper way. So I think that even though I've seen this document more than a week ago now, that the reason why this has not yet been adopted is because the government is clearly thinking about changing a lot of things. So here we can, I could see that some things, these rules that are copied from those guidelines and recommendations that were applicable during the state of national emergency, such as the distance of 2 meters between people, then having only one person working in the area of 4 square meters. Yes, so this was a rule. This was a recommendation that was applicable also earlier. So before the state of national emergency was lifted, and because of that, even though I think that a lot of that this decree, if it becomes adopted, it will be different in many ways, but probably not in those when it comes to those guidelines that were applicable before. So I think that this 2-meter distance and one person working per 4 square meter, if this is possible to organize, having in mind the specifics of the business process.
Yes.
So the wording is the same as in the conclusion or the recommendation of the government during the state of national emergency. This is something that I presume that will remain. But we have a lot of new, pretty interesting rules that are, I think, being considered, but for which I hope that not all will be implemented. There is a rule on mandatory measuring of temperature with that no contact thermometer for every employee and for every visitor to your workspace at the entrance. So this can be problematic from a lot of angles. The first thing that comes to mind is, can you imagine, big retail shops and the lines that will form, in front of those shops, where you have one person in front of the entrance, measuring the temperature and allowing the entrance only to those that have temperature lower than 37 degrees, Celsius. So that will certainly be interesting. And also that there is this aspect, of personal data protection. This is temperature of people is a collecting of personal data, and this is especially sensitive data because it's health data. So there the cases where you can collect this data and use them, process them further are very limited, and it's really questionable whether you can do this by way of a decree and not by way of a law. So it's something that will that has already caused a lot of stir, you know, in the expert community. But when I also had an opportunity to hear the commissioner for the Serbian Data Protection Authority, Commissioner for Protection of for Personal Data Protection, at a webinar some 10 days ago, and when asked whether you can measure temperature of employees, you know, in order to create a safe, to protect other employees and create a safe working environment for everyone, he said that you know, that there's this problematic option of collecting personal data, but that he expects that that the government, that the authorities will probably regulate this, and then then if we have a regulation regarding that this might be in the general picture, having in mind that this is an epidemic, that this might be something that would not be considered that problematic. So until we do have this clause, this is definitely something that we do not recommend for you to do, especially to record data on temperature. If you know, use this as if you do not record it, but use this as a way to, you know, not allow entrance into your workspace, you know, for visitors without recording anything, that might be something to consider. But anyway, be extra careful with that. There are also, I will just go through several other interesting things. This decree also mentions that, you know, that the employers need to either shut down the central air conditioning system, or to use it at a lower pace, and to clean it regularly. So there will be a problem there if this gets adopted. You know, there are many business buildings, especially New Belgrade, the buildings, the one I'm sitting in now, cannot open windows, you know.
Yes.
So shutting down the air conditioning system, that is something that will not be possible for many businesses. You know, we have summer months coming up, and also getting fresh air, into the room is also one of the rules. So it will be really interesting to see whether this will become something that you really need to consider. Also, yes, you need to. One other thing that will probably be a problem is the rule that I expect that they will consider and adopt it in a different way, is the ban on allowing the employees to order food, you know, from restaurants, to order the
Delivery, from the delivery, yeah.
Yes, and also, I mean, I cannot imagine considering that we also already had the rule where canteens were prohibited, the work of canteens were prohibited with the employers during the national state of emergency, combining and that the delivery of food was allowed, and now we have this rule. This is something that, you know, will definitely create a lot of difficulties for a lot of employers, especially those that do not have a lot of restaurants nearby where the employees can go out, and you know, going out and mixing with other people also creates exposes you to additional risk. So why not?
And you know, going out for breaks, I guess, you know, you can't contain people for 8 hours, you know, no air conditioning, no delivery.
Yeah, so that's why I expect that the government reconsider this and at least allow, you know, deliveries to be made in front of the workspace, you know, at the reception desk below, you know, in front of the building or something like that, because this this will basically not allow the employees, you know, to eat during the 8 hours of work. So it's not a lot of people can bring their own food because not a lot of companies have, you know, refrigerators to keep all the food of all the employees, you know, safe until the lunch break, you know.
And sorry to interrupt, especially like the large companies that employ so many people. You know, exactly. That would be even a big problem for them.
Yes, certainly. So I really think, so that's why I think that the decree, the way that I saw it, the draft will definitely, I'm hoping that it will look a lot different once it is adopted. And I see that we have a question from Tijana Koprivica. Is it clear regarding the rules if we have to make 2-meter distance and wear masks at the same time at the office? Yes, this is also something that that I heard that was a question that was asked to the Ministry of Labor and through that channel to the government. I think that that does not make a lot of sense if you have to impose both rules at the same time, you know, both the distance in the working environment, both the distance and the wearing of masks. And if you add to that no air conditioning, you know, can you imagine having people work 8 hours? I mean, I wear my mask. I can wear it like for half an hour and that's it, because I'm sweaty and it's hard for me to breathe. I know that this is something, our new normal, that is something that we need to get used to. But you know, there are a lot of, you know, working conditions and in hotter spaces where people doing some manual labor. That becomes very difficult. So one of the questions that was asked, you know, was whether this can be changed in order to, you know, either if you have an opportunity to separate people, so to create that safe distance, to then disregard the rule on the obligation to wear the mask, because, you know, if the distance of 2 meters is safe, then it's questionable whether we need to wear the mask all day.
Well, my
this
comment,
is something that I hope that will be resolved, because this will definitely create a lot of problems in practice.
you know, my comment is, as much as I appreciate that, and it's easy when you have these guidelines, you know, that they make sense and everybody's looking for help. What's the right way? Obviously, we are thinking, what are the right ways to prevent, you know, health of your employees? But then, you know, it is so complicated and we don't want it to be cumbersome that, you know, we can, otherwise we'll stay and work at home, you know, because from a logistic point of view, I'm not sure everybody has 4 square meters per an employee, you know, so then it will make like, let's work from home, you know, I don't, and like you said, you haven't heard that any of other countries is doing something like this. I think this is great. This would be perfect as long as it's in moderation and that we could function well, you know, and I'm hoping that the measures that they come and adopt will be more sensible and allow us to be careful, but yet be able to operate. Because if they adopt even one of these things you're saying, it will probably make the employers decide to say some people stay at home and some work from home, some are in the office, because like you said, it is already, you know, you're working, you're trying, and then with all these conditions, it's not comfortable at all.
Yes, but it's clear also that we need to have rules. We need to have a clear set of rules, because employers need to know what they absolutely must comply with. Because there is this, when I mentioned this obligation to create a safe environment, this also means that you know how to create a safe environment, and also because together with this obligation of the employer to create a safe environment, there is also the right of the employee to refuse to work if the conditions are not safe. So you need to balance that out then. Well, I mean, if an employee, you will always in companies where a lot of people work, there will always be a certain number of people who are really scared, you know, for their health, for the health of their families. Some have, you know, some chronic diseases, or are older, or have family members who have such problems, who are sensitive, you know. So there will be a lot of people who will be scared of that, and then they come to you and say, no, you're not, I feel in danger at work. So you have not created a safe working environment. And that's, you know, then this is the moment where you need the rule, where you need to know whether you've actually done everything that you needed to do. Because if we have a loophole in this area, this could create a lot of, you know, litigations. If you know, if you basically, if you cannot allow this to continue, you need this employee at work, but the employee refuses.
Or God, yeah, and God forbid that somebody gets sick, you know. That would be even tragic. Like, what do you do? But like you're saying, assuring that the measures are there, that we're all following it and doing everything we can, which we've done in the last 2 months. We just need to continue that trend. And I agree with you. You know, I really hope that the rules will be coming very soon, because as much as we got, you know, the message from the government that we should be going back to work, we should be returning, we should be, you know, starting to use May and June. We're halfway to May, and we still don't have these rules, you know, how to bring the employees back safely. We're doing it on our own, right? Like,
so in this meantime, even though I really hope that this will come soon. In the meantime, my recommendation would be to apply at least those measures that were a part of the set of guidelines or recommendations during the state of national emergency. I know that a lot of companies have already implemented them and applied and adopted those plans of preventive measures that they need to that they will also. So this plan of preventive measures, this is a term and a document that was mentioned also for the construction industry during the state of national emergency. This is also something that will become mandatory if this decree is adopted. So all employers will need to adopt this plan of preventive measures in accordance with the procedure this plan of preventive measures will be an integral part of the act on risk assessment for each job position. The process of change of fact of risk assessment is regulated by the law on work safety, and it's a bit complicated. You cannot do that on your own in most of the businesses that employ more than 20 employees and that belong to certain industries. You need to have that that person who is the person responsible for work safety licensed. So either an agency or your own employee, but the process is a bit complicated, requires certain steps, and it's not it's not clear whether all the companies will be able to change that quickly, you know, especially those that hire third parties to act as persons responsible for work safety. There are not so many of them here in Serbia, so I can imagine, you know, that not many employers will be ready. And the decree mentions that you have a deadline of 5 days, you know, to change the plan of preventive measures whenever certain measure is changed. This is also something that was commented on as a problem in regard to this draft. So I hope that this will also, that the procedure for the plan of preventive measures for adopting it will be slightly different and adopted to this specific scenario that we're living in with COVID-19. But yes, so there are a lot of obligations that come ahead, but at this time, at least apply those measures that have been mentioned, or there were guidelines during the state of national emergency, because I expect that all of those measures at least will become mandatory once the decree is adopted. For everything else, yeah, I hope that they will not regulate all of that in so many details as it was in the decree, because some of the things will really cause problems. But those general things related to distance and protective equipment, these are something that you should definitely apply and implement in order to create a safe working environment for your employees.
Absolutely. And what I would add, this is temporary, right? It's the measure that we need to, abide by and act upon. And obviously, as soon as the numbers are showing that it's no risk, they will probably drop those measures. It's not forever.
The decree itself does not mention that it will be applicable only during the epidemic. However, it makes sense because it makes sense that for that to apply only during the epidemic. I see that Tiana has waved to us. She wants to ask a question. Okay. Feel free.
Hi. I have a lot of questions.
Oh, okay.
First of all, yeah, we are a geology company and we work on field. So we have big field crew, and half of that crew are people from different countries. Mm-hmm. We work on rotations like 24 days in Serbia and 1 week at home. So does that mean that they will be able to travel every rotation with negative tests not older than 72 hours?
Yes, that means that they will be able to enter Serbia with this test, and also if so, I presume that these are people who have a temporary residence permit, right?
Yes.
Yes. So then they will be able to enter with this test, negative test that is not older than 72 hours. But of course, it depends also on the country that they will be traveling to, on their rules on acceptance of people entering into their country. Most of the countries have been, I've been following news around in this region and wider. Most of the countries are mentioning these the negative PCR test in 72 hours, but it's up to you then to check when you plan the trip what are the rules also for the country that this person will be going to.
Yes. Okay. Next question is, because we do field work, all people, almost all, more than 50% workers are from different towns in Serbia. So company provides accommodation. Some people live in hotel during field work and other people sharing apartments. How we will protect health of those people? It will be a regulation for that, or it will be left for each company to solve that on his way?
The draft decree that I mentioned that we talked to during this meeting, does not specify, so does not give a clear answer to your question. So this will not be regulated. So it's up to you to make sure that all of this is done safely. When it comes to hotel rooms and if you have one person staying there, I think that will be okay. But I'm a bit worried about the apartment sharing. I presume that perhaps your employees will be comfortable with that, and then it's okay. You should just definitely implement certain rules that you think that they will be comfortable. With. But if they are not, and if they there is this is a very sensitive area, living with someone in these circumstances, so you need to tread this carefully. So you should definitely adopt certain rules in order to make to make people feel more comfortable in these circumstances. But this is not something where we have a clear set of rules. So this is for you to decide based on knowing your employees and the work process and how ready they are to accept this.
Yeah, thank you. and more questions about commute to work, because we share cars, and we can't put one person in one car because field teams always have 2, 3, or 4 people. So in that case, is it enough to people have safety glasses, masks, and gloves for work?
I think that it should be enough. You know, if you set if you have a clear set of rules, but do regulate that. You know, commuting to work, so that people are really that people know what to expect. That people can raise concerns if they're not feeling comfortable with the rules that you set, and certainly make them all wear protective equipment and clean the cars more regularly. You know, you will need to since this will be a part of their coming to work, you should treat it as a workplace. So
Yes.
You should also disinfect the areas, the furniture, the inside of the car on as a regular matter.
Thank you very much. I don't have any more questions.
You're welcome. Thank you for joining us.
I think we're close to the end, and I would like to wrap up this webinar. I would like to thank Madam Ambassador. I would like to thank Dragana Bajić, all the guests that were listening, asking questions. I think it was a very informational, you know, for everybody. And just stay safe. You know, we're eagerly awaiting this set of rules. Like Dragana Bajić said, they do play a crucial role, especially with the law, you know, and the obligations of an employer, and also our employees. So it's a two-way street, and it will help, you know, in movements and how we can run our businesses safely, because we need to move economically, and somehow, you know, this time that we had to close the businesses, we have to, you know, find ways to work and make up for it, because life goes on. And, you know, I'm hoping this was one experience that it will not come back. It was difficult, it was challenging, but like Madame Ambassador said, like you, Dragana, said, we learned. I think we learned a lot, you know, and life goes on. We move, we're positive, we have each other, and there has been a number of online webinars. We have been, one thing that I could share quickly is that we have been in touch with a lot of people. We talked a lot via, you know, computer, via telephone, different devices, but we have learned and heard how everybody feels, and we should take this as a very serious matter and incorporate it in our lives. You know, it's something that it has positive side to it as well. I want to thank you again, and all our guests. Have a great day, and, you know, do not hesitate to contact either CANSEE or Embassy of Canada, or our proud member KINSTELLAR.
If I may, I will just quickly share the screen. Here you have my contact details, just in case someone has some additional questions.
Perfect. Thank you very much, and to all of you, and have a great day.
Thank you.